Hello, my beautiful viewers out there. It's another great opportunity and privilege for me as an individual to sit here and serve you once again. I must appreciate the fact that you all have been so marvelous and beautiful. You made this channel blooming. You made it a wonderful one. You made it possible for me to keep posting videos, and I must appreciate the fact that you all have been so beautiful. Taking your time to watch my videos over and over again has been just one of the greatest experience that I as an individual will ever come across or we ever experience. I must appreciate you all that you all have been so beautiful out there, and thank you all for taking your time to watch my videos. It's also it's like I don't know the phrase to use to qualify this word, but you all have been so beautiful, and you making this possible for me, because without you I am just like nothing. Because if I'm posting my videos and nobody's watching, that wouldn't give me the courage to post the videos over and over again. But I must appreciate the fact that you all have been so beautiful, you all have been so marvelous, you all have been so wonderful. Like, I lack words of appreciation to appreciate you all and to thank you how you all have been so beautiful and wonderful out there. Thank you so much. I remain your favorite boy, Daniel Elisha Avaka. I bring to you on this channel good and reliable sex education topics. Topics that will give you wonderful education about sex. Sex has been over the time a topic so many people shy away in our families, in our religious gatherings, in our school, and several places that we expect this topic to be taught in depthly, but it's a topic that so many people shy away. They don't like talking about it. But I, as an individual, have taken it upon myself to give you the way it is to be served, like give you the way it is to you, raw, in a way you will understand. So thank you for always staying with me. For the beautiful people that have subscribed to my channel, wow, it is a wonderful one. Thank you all once again. Thank you. And if this is your first time of viewing my channel, hit the subscription button down, because trust me, you will never regret subscribing to this channel, because it is going to be a beautiful one. For a couple of days now, I've taken my time to really make a research and study, asking questions upon questions, searching the internet over and over again to come to a conclusion and to bring out points that will summarize this topic I am going to talk about now. And after that, I've came to a conclusion that under 5 subtopics or 5 points, I will summarize the entire topic. And what is this topic talking about? I am talking about today reasons why your menstruation fluctuates. So under this topic, I came about 5 subtopics or 5 points that summarize everything why your menstruation fluctuates. The ladies watching this video can bear me witness that it is not every time your menstruation fall on exactly 28 or 30 days or 25 or 26 days. There are sometimes it's fall on 22 days, there are sometimes it's fall on 30 days, or sometimes it fall on 27 days. And what are the reasons responsible for this? And there are some months that your menstruation ceases, it doesn't come at all. Under 5 points, I am going to teach you the reason, or tell you the reason why your menstruation fluctuates, why you witness irregular menstruation. Trust me, you will never feel reluctant, or you will never feel as if you wasted your data watching this video. Number 3 and number 4 are very important that you must not miss. But the number 5 is the most important that you shouldn't miss at all. So come along with me as I give you these points one after the other. Number 1 is uterine fibroids. What are fibroids? When you hear the word uterine fibroids, what are fibroids? These are growths that can develop in the walls of the uterus, that is the womb. They are growths. They are not natural growths, but they develop. They grow in the your stomach walls, your womb. As a woman, you have a womb where you conceive your baby, where after the fertilization of the zygote, the implantation of the zygote after fertilization, where it is being fertilized and it develops for the 9 months you carry your baby, that sac is called the womb. So the growth there is known as this fibroid. Most fibroids are non-cancerous, that is, they are non-cancerous, but they grow, they range between I will talk about that. They are not cancerous. They can range from the size of an apple seed, that tiny apple seed you eat, that very tiny apple seed you eat. Once you dissect or you divide your apple into two, there are about two or three seeds you see in the middle. So once it starts growing, it will be as tiny as that, that apple seed. If you don't know an apple seed, go to the market, get an apple, dissect it into two. Be very careful so that you not divide the seed. Dissect it into two, and you see some tiny tack stuffs around the middle. There are usually like two or three around the middle. That is an apple seed, to the size of a grapefruit. A grape, just like orange fruit. It just starts that tiny, but it grows to the size of an orange fruit. Yeah. A person with fibroids may have periods that are painful and heavy enough to cause anemia. If you're having fibroid, your menstruation might delay. It might delay, or it might cause you anemia. You have very heavy, blood flow. Menstruation usually comes, it varies. Your blood flows in every month, it varies. So depending on how this fibroid is as big, so if it is just starting, you might not witness heavy blood flow. But if it has gone as big as the size of a grapefruit, it might cause you a very heavy blood flow, and that might lead to anemia. They may also experience pelvic pain or pressure, lower back pain at your back here around your waist region. You'll be witnessing your lower pain, and you also leg pain and pain during sex and other stuff like that. So there are other symptoms also that one experience or one occur when you are having this fibroid, uterine fibroid. This fibroid grows in your stomach. And so what are the treatments and remedy to go about this? Over-the-counter drugs can help reduce the pain during sex, and also large or big fibroids may require surgery. When people are having large or big fibroids, the doctors sometimes recommend surgery so that this fibroid will be removed entirely. And if care is not taken, it might lead to other complications. I know it is best to see a doctor if symptoms occur or persist. Over-the-counter drugs are not always good for our health. Using drugs that are not prescribed by a very good physician is sometimes risky and dangerous to our health. So when you are having this fibroid or these symptoms of fibroid in your body, it is best for you to go see a doctor. Number two, we have underweight. Underweight, there are some people that, I'm watching my weight, I don't want to get orobo. We call it orobo. I don't want to get fat. I don't want to do this. I don't want to do that. My husband doesn't like me getting oversized. I don't want to get plump. I don't want to get in this. I don't want to get that. Drinking, slim tea and several things like that. And as a result of that, you discover that you and your menstruation are lagging behind. What do I mean by that? Your menstruation will start fluctuating. To start going up and down like Nepal light, bush, to start going on and off, and you will not pay attention to that, which you are causing harm to yourself, taking pills that will make you slim down, and it is causing you another havoc in another area, but you are failing to pay attention in that. So excessive or rapid weight loss can cause periods to become less regular or stop. You understand the statement I made? This happens when part of the brain stops releasing hormones that impact the menstrual cycle. A person with underweight may develop dry skin or hair, thinning hair, tiredness, difficulty in concentrating, also difficulty in getting warm, a low mood. People who are always moody, underweight, always moody, they lack concentration at a point, difficulty in getting warm, tiredness all the time, dry skin. These are some of the symptoms that underweight people experience at a particular time. It is good to be fat, but not over fat. It is good to watch your weight, but while watching your weight, do not take drugs or take tea. We have slim tea, we have several things that will help reduce. We have some people who have all this native mixture of trees. You call it in this part of the world, we call it agbo. All these drugs that you take that will help lower your, your system down, will help reduce lipids or fat in your body, but are causing you havoc in another aspect of it, like irregular periods. So you have to watch. Once you are taking this drug, you have to watch not to get affected in another aspect or area of your life. So these are some of the symptoms when you have underweight and you are experiencing irregular or menstrual fluctuation. We have dry skin, we have thinning hair, we have tiredness, we have difficulty in concentrating, we have difficulty in getting warm, we have a low mood. So these are some of the symptoms that are associated with underweight. And when you are losing weight, this happens when a part of the brain stops releasing hormones that impact the menstrual cycle. I've said that earlier on before. So you have to be very, very careful about that. So what are the treatments when you are experiencing menstrual fluctuation or irregular menstruation, and you are witnessing underweight, or these symptoms I've mentioned earlier on? Number one, underweight can be detected by calculating one's body mass index, that's BMI. If you are underweight, it can be detected by calculating your body BMI, that is body mass index. If the BMI is lower than 18.5, then that means you are underweight. This can be done in any of the hospital or clinics you find around. Just go to or walk to the clinic and tell the person, that the physician or the nurse you meet there, that you want to calculate your body mass index. So if it falls lower than 18.5, that means you need to watch yourself. It is 18.5 means underweight. Check your BMI to see if this could be the cause of irregular period. If you're having irregular periods, it is good that you go to the hospital to check your BMI, that is body mass index. If it is lower than 18.5, that means you are lagging in this aspect, and you need to take precaution. Last treatment for this is if a person finds it difficult to stop thinking about food or weight loss, the person needs to speak with a professional physician. If you find it difficult to stop thinking about food or the way you are losing weight, then it is possible and advisable for you to consult a physician. Number 3, excessive exercise. That is one area whereby so many people fall victim of. We have people who dance, ladies who dance, we have athletes who run, we have footballers, we have people who participate in high jump and several other activities that affect their menstrual cycle. But it is so unfortunate that several of them don't pay attention to this at all. They just feel it is just normal for them to just maybe have menstrual seizure or menstrual fluctuation. It can go this and that. Some people go as far as having menstruation twice a month. It is that bad, but they fail to pay attention to this. So today we have exercise. Number 3, the third point here is excessive exercise. We have excessive exercise also interfere with the hormones responsible for menstruation, making your body agitated. This is common in athletes. We have dancers, we have people who train excessively. It affects the hormones that is responsible for menstruation, going up and down, like a car that the petrol is almost finished. It will be going front and back, jacking this and that. That is how some people's menstruation is. It will be jacking to and fro, and they fail to pay attention to that. Sometimes you have it at maybe 25 days, sometimes 30 days, sometimes it will cease in a month, it will not come at all. It is common in some athletes. You can have a conversation with one or two of them and see if they really understand and know what they do. So what are the treatments to do? Reduce excessive exercise. That is point 1 under the treatment of excessive exercise. Reduce excessive exercise. Take enough break to rest. Have enough time for yourself to rest after undergoing all this brutal and excessive exercise, just to train yourself and to reach the peak of your career. Take enough time to rest. Eat healthy food. Some people, after this exercise, they go to gym, play football, do this and that. They don't take enough time to rest. So you have to take enough time to rest. Number 4, the fourth point why your menstruation fluctuates is medications. Intake of drugs. Most especially, so many people don't take prescribed drugs, which is very harmful to their body, and they don't take some of these contraceptives you take are very harmful to your menstrual cycle, but you don't know. That's why some people, after taking these contraceptives before getting married, over and over and over and over again, once they are married, you discover that it's either their menstruation ceases for a very long time and they have difficulty in conceiving, or it stops at all coming. So these are the effects of some of the drugs you take that has accumulated in your body, and now they are manifesting. So you see some people saying, I'm married now and I'm not having my periods as regular. My period is coming once in 2 months. My period is not coming at all in 6 months. Some people will not see their periods in 6 months. Some people after a year they will not see their periods. Some people for 5 years they will not see their periods. It is the effect or the manifestation of the accumulation of the drugs you have been taking over the time. That's why I always encourage ladies, it is best and safest for you to abstain from sex before marriage than you going to take contraceptives for your boyfriend or so-called fiance that you will not get pregnant. These contraceptives are so harmful to the body, but to not have it, my advice will fall on deaf ears, but it's better for you to abstain from sex before getting married. And that is one of the publicity or the announcement, or what I have keep ringing in the minds of everyone that watch my videos, to abstain from sex before marriage. And that is my key word for establishing this channel. So some drugs female consume has great effect on their menstrual cycle. This include blood thinning medications such as aspirin. As little as aspirin is, it has a very great effect on your menstrual cycle, but you don't know. If you want to know more, then consult a physician for that. I am not a physician. I'm only a sex educationist that bring this topic to you and give you an eye opener about these topics. Number 2, we have thyroid medications. Number 3, we have antidepressants. We have chemotherapy drugs. If you want to know more about all these listed drugs, you can go and either search on the internet or you consult a physician. It is best for you to consult a doctor, because on the internet you might not get the complete information as you ought to. We also have epilepsy drugs. We have thyroid medication, we have antidepressants, we have chemotherapy drugs, we have epilepsy drugs. So these drugs are very harmful to our menstrual cycle, so it is very good or advisable for you to take it under prescription by a very good or recognized physician. So what are the diagnosis or treatments of medications whenever you are being affected by this? Number 1, medications that cause menstrual fluctuations are not always harmful though. However, if you face or feel threatened, you can consult a medical doctor. If you take any drug and you have difficulty in having your regular menstruation as it is also, it is good and advisable for you to consult a medical doctor if you feel threatened. Number 2, do not adjust your dosage or any medication without consulting a doctor. If you feel you are having or taking any drug and it is causing menstrual fluctuation or menstrual seizure, it is good for you to consult a doctor. Do not say, because I'm taking 1, then I'll reduce it to half, or because I'm taking 2, then I'll reduce it to 1. That reduction or that adjustment will cost you, it may cost you more harm. So it is good for you to consult a medical practitioner before adjusting any drug you are taking if it is affecting your menstrual period. Number 5, and my last point, but not the least, we have stress. This point is very common in villages, and I must emphasize on this in our homes, that parents should please be giving our female sisters, or our female children, the ability or the opportunity to rest after a while. In most homes, the female are the ones that undergo most of the work done at home. That is the home chores, washing of plates, washing of clothes, going up and down. So after school, stuff like that, they will still have this stress. The female body is not designed to undergo such a very long or prolonged stress. They need rest after a particular work. They need rest. Though women are designed to multitask, fine, acceptable, but they need rest. High stress level are associated with irregular periods. When a person is overstressed, the body releases stress hormones such as adrenaline and cortisol. These hormones interact with sex hormones that regulate the menstruation of the body. We have adrenaline and cortisol. These are the two major stress hormones in the body, and once one is overstressed, the body will release this hormone, and these hormones have a way of communicating with the menstrual hormones in the body by reducing the menstrual cycle of the body or causing it to cease at all without coming. Because menstruation, when a woman is menstruating, she's losing blood, she's losing part of her body, and she needs a replication of that blood. So if your body is stressed, it is another aspect of it. That is, if your body is stressed, it needs another protein, more protein to replicate it. So if you don't have enough protein in your body to replicate the lost tissues as a result of your stress, then it is either that hormone, that is the stress hormone, communicate with the menstruation hormone to cease menstruation, so that the protein you have in your body will replicate the lost tissues as a result of stress. That is the reason why once you are stressed, it is either your menstruation reduces drastically or it is ceased. In a month, it's possible that in a month you will not have menstruation at all. So that is the reason for it. So it is good for you to take a rest, and after stress, it's good for you to eat a healthy diet that is rich in protein, that will help to nourish your body. What are the treatments about this? Short-term stress can help you respond to threatening situations. However, chronic stress is harmful to the mental and physical health. Number 2, avoid chronic stress. Rest at intervals. Do not walk like a camel. Do not walk like a horse. Do not walk like a programmed robot. Rest at intervals. Take time to sleep. Sleep is very important. Take time to sleep. Though not oversleeping, but take time to sleep to gain your lost stress. And my last point, consult a doctor if you feel overstressed and you witness menstrual delay. So today, that is the video I have for you. Have you subscribed to my YouTube channel? If no, then what is delaying you? Hit the subscription button down. Never forget to share this video with your loved ones, and to encourage people to also come and watch this video, because trust me, on this YouTube channel I'm going to bring you more interesting sex education videos, and trust me, it is going to be blast. I don't encourage sex on this video before or outside marriage. I encourage sex in marriage. I don't encourage premarital sex. But you need to know the consequence of all these things, how it is being done. That is the reason why I came up with this channel. I don't encourage premarital sex. I don't encourage extramarital sex. I encourage only the sex that is done within a legally married husband and wife. And that is one of the key reasons why I came up with this channel. So feel free to share this video with your loved ones. And trust me, I am your favorite sex education analyst. I am Daniel Elisha Avakab, and this is my YouTube channel. Thank you once again for watching and coming this long way for me. I really appreciate your effort. Thank you.